Australia could become the first country to eliminate cervical cancer. Researchers say this breakthrough could be made within the next 40 years due to a national immunisation program of the HPV vaccine. Well, cervical cancer rates amongst Australian women has dropped significantly over the last 10 years already. Let's get more on this. We're joined by Suzanne Garland, who is the Director of Infectious Diseases for the Royal Women's Hospital, who joins us live from Melbourne, Australia. Many thanks for joining us here on TRT World, Suzanne. I've lived in the UK where there is already a serious push to raise awareness on cervical screening and cervical cancer. But for the benefit of our viewers who may not know much about this, can you explain what HPV is and why this vaccine program is so significant?
Okay. Well, I should tell you, today is HPV Awareness Day, and that is right around the world. So we want people to understand about the virus called human papillomavirus, or HPV. And this is actually the cause of 99.9% of cervical cancer in women. It also causes a proportion of other cancers, of the female genital tract, of the anal canal in males and females, but also a cause of a proportion of tonsillar cancers and back of throat cancers. So the virus is really common. Most people pick it up when they first become sexually active, and most people get rid of the virus due to their host immune responses. It's when it becomes chronic that then, in taking many decades, it can cause cancer. Now, there's a safe vaccine available now against this virus. The Australian government endorsed the vaccine right back in 2007. So we've basically been using the vaccine targeting 12 to 13-year-old girls, but also 12 to 13-year-old boys. So it's a gender-neutral program. And as well, we've had a catch-up program for the girls the first 2 years up to 26 years of age. Now, I think what's so important is that the community has embraced the vaccine program, and we've had very high coverage in the order of 77% in the 12 to 13-year-olds for 3 doses. Now, the good news is that we have found in our surveillance that this has dropped the infection rates by a huge amount. And if I give you an example, we used to find in 25-year-olds about 25% had these viral strains. Since the vaccine has been given to the community, it's now down to around 1.5%. If you reduce that whole pool of virus, you're going to reduce the disease.
Indeed. I mean, it's an absolutely brilliant result. I guess the question is, so this has been very successful in Australia. Where else is the vaccine currently being used, and how easily could it be made available to other countries that are not using it? There are 3 types of the vaccine. And in fact, what's important for people to realise now, just 2 doses is all that is required, not 3 doses, so that makes it easier to distribute the vaccine. The governments of countries really have to support this, though, and the other thing to tell you is it's a very safe vaccine. So the quicker one gets the jab in the arm, the quicker you have the opportunity to prevent these diseases that are caused by the virus. But is it an affordable vaccine? Is it easily accessible elsewhere in the world?
Oh, yes, definitely. Cost is an issue with new vaccines, and it's up to the individual governments to talk to the pharmaceutical companies to get the best price.
Okay, Suzanne, I'm afraid we're out of time, but really, really interesting to talk to you. Suzanne Garland there, Director of Infectious Diseases from the Royal Women's Hospital in Melbourne, Australia.